when I went through in 2008, it was very different than the type of discussion that was going on around those things, like what I experienced. So I had, professors who we would do a class, so it was like our treatment models class, the first one that we did. And in that class, we were learning, let me think, cognitive behavioral therapy, structural family therapy, strategic family therapy, and internal family systems. Those were the four models we were learning. We would cover a treatment model, and at the end of every unit, where we studied, cognitive behavioral therapy, the professor would then go, okay, so now we're going to do a feminist critique of this model.
And this is Abilene Christian.
Mhm.
Really?
Yeah,
Wow.
this was
Okay.
in 2008.
Wow. Okay.
Yeah. Now, I feel like that professor was not like she was not pushing, she was not at least very strongly pushing somebody to adhere to that ideology, but she viewed the ideology as valuable. And so we would use it at the end of a unit. So, it would be like, okay, so what kind of problems would this model potentially pose to somebody from Hispanic background, or from who was a woman if it was a model that was created by a man? And it would be kind of very small, piece of discussion at the end of a discussion of a treatment model. So the other thing that I think was kind of more honest about that than what maybe is done now is she was very honest about, okay, this is coming from intersectionality.
Hmm.
And, in the intersectional view of things, we see that there's been a history of certain groups having power and other groups having less power. And so she said, this is not a treatment model. It's not equivalent to a treatment model, what we're doing here. It's a separate theory that we're using to critique the models. And
Hmm.
so that was a little bit more compartmentalized than I think what is done in some places today, where I think a lot of professors, a lot of students coming out of those programs they are not even aware that intersectionality or critical theory is not a therapeutic theory, that it's not equal to, it's an entirely different discipline, it's an entirely different
Yeah.
subfield that has kind of gotten plugged in, inserted itself into therapy where it was not there before in that way.